Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today we continue our conversations around the COVID-19 pandemic. And if you have questions or comments, please feel free to send them to 620-6275 by WhatsApp, or you can send an email to docandcovid@gmail.com. Today we are very fortunate to start a conversation with one of the most experienced media operatives in Guyana, someone who has been in the business for quite some time and has worked with several governments, both internally in Guyana and externally outside of Guyana, always representing the interest of Guyana and Guyanese. I would like to take this opportunity to welcome Mr. Kit Nascimento to the program to have a conversation with us today. Welcome, Mr. Nascimento.
Thank you very much, Doc. It's my pleasure to be here with you today.
Thank you. So we are at least 7 feet apart, and if you don't mind, we shall take the masks off for the remainder of our conversation. Is that okay with you?
Absolutely, yes.
Okay.
But before I take mine off,
yes,
I notice, and I love it, that you always give an explanation as to how a mask is meant to be worn at the beginning of these programs.
Yes.
And that is going to be one of my first concerns I express to you. But before I get there, I would like, first of all, to take this opportunity to really thank you and congratulate you on these programs that you are doing. I think they are of enormous benefit to the country as a whole, an enormous benefit to each one of us who are threatened by this dreaded disease. It is only by looking on and listening to you that our people are able to be educated and learn about the horrors of this disease, how we can live with it, and how we can deal with it. So I think you're doing, Doctor, if I may say so, an invaluable service to your country.
Thank you for those generous words coming from you. It means a lot. So I just wanted to follow up on what you mentioned, the correct way of wearing the mask. I'm sure you and I have both seen persons around the city in Guyana with masks hanging off the chin, masks on below the nose, and there are some rather humorous ways of describing the way people wear their masks, but for practical professional purposes, for it to be effective, the mask has to cover both the nose and the mouth. That protects you as the wearer, but it also protects those around you if you, the wearer, happen to have some kind of communicable diseases that can escape through your nose or your mouth. So it's very important to wear the mask covering both the nose and the mouth. And when you're taking it off, grab it by the straps that go around the ears so you can take it off rather than holding the main part of the mask, like the front of it, because that's where the infected particles would actually be resting. And if you touch them with your hands, instinctively you may also then rub your nose, rub your cheeks, rub your face, rub your eyes, and it can then enter into the body. So with that said, if you want to, you can take the mask off. We have our distance, which is at least 6 feet. I believe this is about 8 between us.
Yes. I have seen on almost every occasion that I drive through a marketplace or on the public road, people wearing their masks like that.
Yes, that's useless.
And worse, people wearing them like this.
You might as well wear a necktie.
Yet, it is prevalent throughout the country. Almost every market stall that I've been to, between Georgetown and Parika, for instance, that is what I see. In fact, sad to say, that the majority of stall holders, they don't even have a mask. If you stop in your car to buy something, you will see them pick up a mask and put it on like that.
And then come to you.
And come to you.
Yeah, that's a dangerous practice because it puts you at risk and it also puts them at risk because they don't know what your state of health is and you don't know what their state of health is. So we shall enforce that the correct way to wear the mask is to cover both your nose and your mouth and to do that whenever you're out in public.
Otherwise, you're wasting your time even having a mask.
Yeah, and I understand. I accept that the mask is not the most comfortable thing to have on, especially if we've spent our lives not having to wear masks. But imagine that small price to pay to keep yourself or those around you out of an ICU, hooked up to a ventilator, which is a much more unpleasant experience.
And I wanted to stress this because it is, in fact, how we as a people behave dealing with COVID-19. It matters not what you say. It matters not what the government does or doesn't do in its efforts to manage this pandemic. If the population refuse to conform and participate. And it's why I bring it here to you today. It seems to me that those few nations in the world that are dealing with this more successfully than most are those in which the people themselves are disciplined enough to do the right thing. And the right thing, as you have constantly said on this program, is to wear your mask properly.
Yes.
And to distance yourself as much as possible as you and I are distanced today. I do not see what is so terribly difficult about doing that. It is inconvenient. I have great difficulty wearing a mask because, and I think many people with glasses, when you breathe into it, it messes up your glasses.
Yes.
But that's a challenge that we need to learn to live with and deal with until we get rid of this pandemic.
Yes.
I thought I'd begin, Doc, in speaking to you about how Guyana is doing.
Yeah. Well, you identified our main challenge, and that is people taking personal responsibility. And you are quite correct in your assessment that the more successful examples in countries that have managed to keep COVID-19 at bay, they are known for having disciplined populations. Places like Taiwan, people like Japan.
New Zealand.
New Zealand is a shining example. There are some particular differences in those nations that, make ours stand out as well. Many of those that have been able to maintain some level of control are island states. They can actually close off their borders, but regardless of that quote-unquote advantage, the people still have a different level of discipline and respect for authority and guideline so that they are followed. Once they are set by the respective authorities, the population will follow. because there is a history of trust that is built between their public institutions and the population. They are confident that what is told to them is in their best interest. And people have seen that work. And it's not a genetic superiority or anything. It's a learned skill, a learned trust that would have been built up over decades among these people.
And we have some countries which are a very bad example. Perhaps the worst of them is the United States of America.
Yeah, it's very unfortunate because, you know, we have strong ties to the U.S. We have our major trading partner is the U.S. We have lots of exchanges, human resources, etc. with the U.S. So it affects us directly when things affect the U.S. A lot of our friends, families, almost every household in Guyana has a member or a close one who is in the U.S. or has been to the U.S.
Absolutely. I have 2 daughters and a number of grandchildren living in the U.S. and in different parts of the U.S.
Yeah. So a lot of the successes and failures of countries that are grappling with this pandemic is dependent on a robust public health initiative, and for the message to get out clearly and for people to follow the advice of the messaging authority. And there is a particular scenario that plays out in the US where people perhaps think that, you know, it's an invasion of their personal freedom, etc. But it's probably something to do with messaging about what is important and how to protect yourself and how to protect those around you. There are certainly ways in which things can be improved, not just the US, but across the world, where the right message needs to reach the ears of the people, those who are most vulnerable to this pandemic.
Yes, I mean, it is in fact an invasion of freedom, but it's an invasion of freedom which is in the interest of safety and saving lives, saving your own life.
Yeah.
Freedom is always curtailed, no matter what it is. Even freedom of speech is curtailed. There's a great example of you don't go into a crowded cinema and shout fire if there's no fire.
Right.
Because the results of that are obvious.
Yes.
So every freedom we have is curtailed by something called discipline and responsibility. We have a responsibility with COVID, in my view, not merely to ourselves, but to every single person around us and to the country as a whole. When one of us starts violating the basic requirements of wearing your mask properly and social distancing and washing your hands, and that procedure, which is repeated over and over and over again, so I'm sure that all of us are familiar with it. When we violate that, we violate the entire country's safety, because one person violating causes another person to be sick or themselves. Right. And that is indeed, if I'm right, Doc, is how this disease is a great threat. It spreads from one person to another.
Yes.
By persons getting close to each other and breathing on each other.
Correct. And a lot of the persons who are spreading this disease are not even aware that they themselves are infected or they are a risk to others because they have no symptoms. And the data, the scientific evidence is quite clear that before you start to actually have symptoms, you are already a spreader as far back as a week. But most people within 48 hours of development of first symptom. So that is why contact tracing becomes an important part in controlling this pandemic.
So how well are we doing with that?
So we shall continue our conversations tomorrow with Mr. Nascimento as we continue talking about the COVID-19 pandemic. So remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. When we come back tomorrow, we shall be talking about Guyana's response and how we are doing in the COVID-19 pandemic. Thank you for watching or listening.